Hello, and welcome to another Spotlight the Science, where we get to meet the researchers who have received funding from the American Diabetes Association. My name is Marlon Pragnell, and I'm the Vice President of Research and Science at the ADA. And today we have the honor of speaking with Dr. Lu Hu. Dr. Lu Hu is a behavioral scientist an assistant professor in the Department of Population Health at NYU Medical School. So she received her PhD from the University of Pittsburgh and her postdoctoral training at NYU. And her research primarily focuses on developing and testing innovative, sustainable, and scalable technology-based interventions to increase access to care and reduce health disparities in underserved populations with chronic conditions. She's been recognized with multiple awards, including a 2021 ADA Young Investigator Award, in addition to many others. Welcome. Nice to speak with you, Dr. Lu.
Thank you, Dr. Pragnell. Thank you so much to ADA for having me here, and also many thanks to ADA for funding my project. Really, it's my great pleasure to be here today.
Yeah. Tell us a bit about your work in population health and health disparities and what you're doing there.
Yes. As you just mentioned, I joined NYU as a postdoc. And before I joined this postdoc job, I'm very clear that I want to learn how to conduct clinical trials and how to support people in their chronic disease management. And then at that time, I worked with my primary mentor, Dr. Marianne Sefik, who has done she has over 30 years of experience in clinical trials in patients with diabetes or patients with diabetes and concurrent kidney disease as well. So she has lots of experience in that. So one day during one of our mentor meeting, I remember very clearly that she said, "Lu, why don't you check out the diabetes in underserved Asian immigrants, actually, because the data that I read, I remember that they are the underserved racial and ethnic minority actually suffer disproportionately higher burden of type 2 diabetes, while they are many more work has been done in African Americans or in Hispanics. Actually, very limited work has been done in the underserved, limited English proficient Asian immigrants. You may want to check that area out." So actually I did. I follow her advice and I went into PubMed. And first of all, I just want to understand what are the disease burden in this population. And to my surprise, actually, I found that one of the EPI study conducted in New York City over 2,000 Chinese immigrants, the data show that almost like 50% have either type 2 diabetes or pre-diabetes, which is alarming rate to me because like I am a Chinese and then my husband is also a Chinese from China as well. That means one of us is actually either type 2 diabetes or pre-diabetes. Actually, I am that pre-diabetes person in between us. So I was really shocked by that number. So I said, oh, wow, this burden is really, really striking, like really alarming to me. And so I went further into the literature to see what research has been done in this area. Like, are there any interventions has been tested in this area? And to my surprise, actually, only I think 3 or 4 studies have been conducted in this area, and many of them published like over 10 years ago and in a small sample sized population and quite old fashioned, like in person, you have to go to a in-person session to attend several diabetes classes, which is just, I said, this is really impossible. In nowadays, we have so many technology tools, and I understand many of the, especially those low-income, limited English proficient Chinese immigrants, they do multiple work jobs, like 2 or 3 jobs. They don't have time to go to in-person classes to learn that. It's just impossible for them. So I began to ask myself, is there any possible that I can leverage the current mobile tools to really help to increase the access of those? We already know there are many evidence-based interventions available. Increase those access of evidence-based intervention to these underserved population. So that's exactly I got that idea, and then I was very fortunate to receive a pilot funding from our NYU Center for Study of Asian American Health. So they have a long-standing U54 center with funding from NIH. So I began to conduct some pilot study in this area, really trying to understand what are some barriers in this population facing as immigrants, trying to manage their diabetes here in the US, and then what kind of assistance they need as well. And then based on this pilot data, I was very fortunate to receive a NIH K99 RO award. So we began to design and testing some interventions in this population as well. And we found really some very, very positive results in that K99 award. So, but one of them, many comments that we received from the participants said, oh my goodness, your program is so great that the diabetes videos, the short videos that you created, like I can understand because they are so simple in later language, and I can relate to my own life because it's all about Chinese style, traditional Chinese style that I'm used to every day in my life, things like that. But one of them, several participants mentioned that even though I have diabetes, but I wish there could be some diabetes prevention programs like 20 years ago that teach me how to prevent diabetes, so I don't need to, worry about getting this. So with that thoughts, then one of my colleagues forward me the RFA, the request for application from ADA, just trying to think about how to integrate the culture into diabetes education. So I said, wow, this is exactly what I am thinking right now and what my participant needs. So I actually responded to that RFA and was very fortunate to receive it. So really thanks to ADA for supporting the project as well.
That's great. I think what we're seeing is, this importance of cultural relevance. I mean, we have in this country so many people from all over the world, from different cultures, and it's so important to kind of educate people on how to prevent diabetes and also live with diabetes, and this diabetes self-management and education support is so critical.
Absolutely.
And what we're seeing is this: it has to be you have to meet the patient or the individual where they're at.
Yes.
You mentioned some of the challenges for the Asian community. I can imagine. I hear also in other areas issues around transportation. Or coming to a meeting is difficult because you have to take time off from work. And immigrants are probably the hardest working people in this country. You have to take time off from work to access and so on. So this it makes sense that the social media, the mHealth approach that you're taking is seems quite an exciting approach for people to kind of save time and actually be more effective in getting their information.
Yes, absolutely. I think as you mentioned, the in-person options can be very, very challenging for these low-income immigrants because many of them have 2 or 3 jobs. They work like almost like 15 hours or even more a day. They can barely go to in-person classes. So making something remotely available to them is very important. So at that time, as I mentioned, my mentor, postdoc mentor, Dr. Safik, they have done the remote kind of diabetes sessions way before the pandemic, because I think we located in New York. I think commute to Manhattan for a class, because I think the subway is easy, but sometimes people, if they live in suburban areas, driving to town can be, parking is so expensive and sometimes unable to get as well. So actually my mentor has been testing using the WebEx platform to deliver those diabetes education sessions to people remotely, and they have lots of exciting data regarding that. Like I think most of the sessions have over 80% of the attendance rate, which is quite high. But when I began to think about, okay, can I do the same thing for my population, for those low income? I think a very serious issue come to mind is the digital literacy issue. So I think many of you probably read that in underserved populations, the digital literacy is real. It is real, even though many of them have mobile device, but they actually they just use mobile device for text messaging or making phone calls. They don't quite know how to surf the internet or even register a WebEx account or Zoom account. Many of the low-income Chinese immigrants that I work with, they don't have an email address. So, which means that a WebEx-based sessions or Zoom-based sessions is not possible for them. And I know that there are lots of mobile apps available to help people managing diabetes or to help people to lose weight. But again, the digital literacy, because they don't even know how to download an app as well. So relying on, and all of those apps are in English. So the language barrier come in mind. So I began to ask myself, okay, so if those complicated platform or apps is not possible for them, what are some assets that I can leverage in my project? I began to realize that, oh, actually in low-income Chinese immigrants, they use social media and WeChat, which is similar to WhatsApp. Is a kind of text messaging app that quite popular in Chinese immigrants as well as in mainland China. But many of my participants, they are family members. They probably, the single person come here, they trying to make money and then mail it back to their family in China. So they use WeChat to maintain connections with their families and friends in China. So this is very, very popular app in the population. I said, this is what I'm going to use, because everyone already know how to use the WeChat and they already use it in their daily life. So I don't need to worry about teaching them how to use, and I don't need to worry about the adoption, because it's already integrated in their daily life. So that's the whole idea. Kind of it pushed me, because the barriers this population facing in terms of digital literacy and also limited health literacy as well, and then the language barrier pushed me to think, what can I leverage in this population to make it work?
Mm-hmm. So you use the WeChat then, but how do you arrive at the content? So you have the DP, this guidance, their standard approach to kind of diabetes self-management, education support. How do you arrive at the content? Or you change it to make it more culturally relevant?
That's really a great question. So that really comes back to the pilot grant that I received from our NYU Center for Study of Asian Americans. So in that pilot study, we conducted really very extensive some preliminary work. So we conducted a mixed method study in over 100 Chinese immigrants with type 2 diabetes living in New York City. So we administered a comprehensive list of surveys trying to understand how they are currently managing their diabetes at home, and what are some barriers they are facing, and what is WeChat, something that based program, something that they would be interested in. So we really asked a series of questions from them. And then we also conducted some intensive interviews. We conducted 25 interviews with individuals one-on-one, almost like 1 hour individual. 1 hour interview with those participants. We are trying to get a deeper understanding what are exactly the challenging part that you are facing in terms of your diabetes management, and how can we help. So from that really extensive preliminary work, we kind of summarize what are some barriers in this population, and what are some really misunderstanding about diabetes in this population, and then what where they need help with. For example, I think by conducting that study, we realized that many of them have never heard of carbohydrate. They said, "Oh, my primary doctor just say, oh, reduce your rice." They thought rice is the only thing they need to pay attention to, but they've never heard of carbohydrates, and they didn't realize like potato, corns, and those starch-based vegetables, they also have carbohydrates in that. So they just didn't realize all of those things. So based on those findings, we trying to really integrate. So we didn't develop the intervention from the scratch. We basically use the intervention from my mentor, Dr. Safik's prior R01 trial. It's called an enhanced intervention. They have shown that diabetes education intervention has been very, very successful in terms of helping mostly non-Hispanic whites in terms of reducing their A1C and improving their diet and physical activity. So they have found great success in that population. So based on the preliminary data we got from our pilots, we trying to adapt. Okay, in this session, when we talk about type 2 diabetes, what culture tailoring piece we can do to make it more relevant to our population. And then we also have a community advisory board as well, which including some Chinese doctors, Chinese diabetes educator, even Chinese immigrant type 2 diabetes patients as well. So we present the initial draft of the diabetes videos to them to show whether this is relevant, this is making sense, and whether this is they understand the content. So we present to them first and gave really lots of great feedback, and then we further revise it before we actually test it out. So there are years of kind of hard work behind really testing the intervention out in real population.
Yeah, it's really impressive as we get to learn more and more about the whole process of developing. You look at all the principles of this approach, and the whole way in which you develop a clinical study, from actually understanding what the issues are, doing the interviews, gathering the information, doing a pilot, and then going for a larger study after that. It's so important because we have insulin, we have so many good medications and drugs and so on out there, but we're having an epidemic of diabetes where people are having high levels of prediabetes and diabetes, and the key thing is to get the message out to people in ways they can understand, and
Absolutely.
they can do improve the way they can live their lives in terms of preventing and treating diabetes. Um, it's quite fascinating. So the approach then is, you mentioned that people have a lot of literacy, the digital literacy challenges. So is it a text-based approach then, or are they watching videos on the WeChat system, or what do they get? What does a person see like during the week as
Yes,
a
that's a great
participant?
question. So we are sending brief videos as a text messaging link, like as a video link to those people on their WeChat. So they just need to click the link, and then the video will pop up. They just need to click the play button, and then the video will play on itself. Usually the video is about 5 minutes in duration, because we also, how do you say, ask, like during our early work, how long is the video kind of idea for you? Many people agree that 5 minutes is a sweet spot for them, because if it's 30 minutes, they say, oh, I lose patience too, because it's almost like a lecture that I don't want to listen to. But 5 minutes is a sweet spot. So yeah, so we are sending kind of brief videos, usually 5 minutes long, to their WeChat as a text message link. So basically, they just need to click the link and then press the play button, and then the audio will begin to play as well. So it can really significantly reduce many of our participants in their 70s. They have no problem of watching the videos. Our preliminary data show that the watching rate was over 90%, and we were able to see significant reduction, 0.5% reduction in HbA1c, as well as we observed 6% weight loss in a small sample as well. So right now we are really trying to replicate this in a larger study. We submit a NIH R01 grant to looking at that, and then for the ADA grant, we are trying to see whether we can replicate the same idea for diabetes prevention, because as I talked to you at the very beginning, the diabetes prevention program has been shown effective over 20 years ago, but the access issue is still huge among the underserved population. So we are testing really, can we do this in same thing for diabetes prevention as well in the immigrant population?
So important and so exciting to see that. And it's just impressive how much thought goes into the whole process of developing this intervention, getting the feedback from the community, even like the length of the videos, I'm sure also too with the diet being different, Asian diet obviously being very different, a lot of kind of thought goes into deciding what's good to eat, where the carbs are, and quite fascinating. This has been so interesting. So then, one thing that's very interesting too is that the principles that you're implementing here, they're adaptable to other areas too, right? For example, you have other communities. Human behavior is human behavior. So you could imagine learnings here could actually benefit other communities that are at high risk for diabetes, like Hispanic communities or African American. A lot of information back and forth, how best to kind of influence human behavior and educate people in the cultural context that's most relevant to their environment.
Absolutely. I feel that you read my mind because we are working with another team to test the same model, basically using either WhatsApp or WeChat to send these brief videos to a Hispanic, like Latino moms, because I think the obesity rate and diabetes rate is quite high in that population as well. So we are testing this similar model in definitely Hispanic population, and also in African American population as well. So we are right now. That's kind of the work is currently ongoing right now.
That's exciting because New York City is such a diverse population from all over the world.
Yes.
And so and to reach each of these immigrant communities, to these communities that with culturally relevant guidance about how to avoid developing diabetes and how to treat diabetes and so on, so important. So this has been absolutely fascinating. I really thank you for the time you've taken. We're thrilled to be able to support you in this really important research. We look forward to really nice kind of data in the near future. And just it's an absolute pleasure to chat with you.
Thank you so much, Manon. Really a great pleasure to chat with you and share my work and with the broader ADA community as well. Just finally, want to still shout out to ADA for supporting my project, as well as giving me several awards in the past for recognizing our work in terms of diabetes disparities and mobile health work as well. I think reducing health disparity is a challenging work, but I think with all organizations like ADA and great leaders like Malone, and I think this is something that I feel hopeful and positive. Really, thank you everyone for your listening as well.
Thank you. It's such an important area to move the needle. Thank you so
Thank you.
much.
Thank you.